And Americans can get their health insurance either from a private company or from the government, or have no insurance at all.
So I think actually the easiest way to learn about this is to go through this pie chart.
Okay.
What we notice is that it's split into 6 different sections, but the major portion of the chart, almost half, is taken up by one section.
Right. So about half of Americans get health insurance through their jobs. It's called employer-sponsored insurance, and this is when you get insurance through the company that you work for, that your parents work for, or that your spouse works for. Basically what happens is that your employer will contract with a private company to offer health coverage.
So these are just companies like Blue Cross Blue Shield, which is what I have, or Aetna, United Health, things like that, right?
Yeah, exactly. And these companies will work with your employer to offer you and your family a choice of health insurance plans. It might be something like a preferred provider organization plan, a point of service plan, a health savings account plan, or several other types. And based on how much coverage you want and how much you're willing to pay, you can pick one.
Okay, so if you're willing to pay a higher premium, you can basically get more services covered under your plan, right?
Yeah, exactly. And the cost of the premium will be split between you and your employer. Typically, the employer pays 3/4 and you'll pay 1/4.
Okay, that makes sense. So let's move on to this next piece here. It's still a pretty sizable portion of Americans, about 17% overall.
Yeah, this is Medicaid. It's a government health insurance program funded by both the federal and state government, but it's run by the state governments.
So what I remember learning is that Medicaid just takes care of low-income people, right? The indigent and the poor.
Yeah, there's some truth to that, but it's a little bit more complex. It covers low-income people, but only in certain categories. People that need the most help. So children, parents with dependent children, pregnant women, the disabled, and seniors.
And they always say that Medicaid is a means-tested program, but I've never really understood what that means.
Yeah, means-tested indicates that the government, when you apply for Medicaid, will check to see how much money you have and how much you make per year. And if you have too much money, you don't qualify for Medicaid.
But since Medicaid is state-run, does that mean the rules are different in each state?
Yeah, exactly. So just because you qualify for Medicaid in one state doesn't mean you qualify in another. This is a big point of controversy currently because the Affordable Care Act was intended to expand Medicaid eligibility in all states. However, the Supreme Court decided that each state could decide individually whether or not to expand Medicaid.
Okay. So that's why there's been all that controversy with the Supreme Court.
Exactly.
So let's move on to the next piece of the pie here. It's similar in size to Medicaid, a little bit smaller at about 13%.
Right. This is Medicare. It's another government health insurance program, but it's run by the federal government, so it's the same in each state.
Okay, so who qualifies for Medicare?
U.S. citizens who are 65 and older, the disabled, and those with end-stage renal disease or Lou Gehrig's disease.
Okay, so just to make sure that we understand each other, so Medicaid is for low-income people in certain categories, and Medicare is usually for older Americans.
Right, and the other big difference is that Medicare isn't means-tested, so the government isn't looking at your income when you apply. All American citizens 65 or older are eligible, and there's also 4 parts to Medicare.
Yeah, that's kind of a confusing point. Let's go over that a little bit.
Okay, so the 4 parts are Part A, which covers inpatient care at hospitals, nursing homes. Part B, which covers outpatient care, like at a physician's clinic. Part C is Medicare Advantage, so this is private insurance paid for by Medicare. And Part D is prescription drug coverage.
Okay, so there's big government health programs for low-income people and for seniors.
Yeah, there's 2 more that we should talk about, which is the VA, or Veterans Affairs System. This covers military veterans. There's also TRICARE, which covers active duty personnel and their families.
Okay, so that's this little slice here, right?
Yeah, that's right.
So whenever people talk about the Veterans Affairs Systems, these are just the VA hospitals we've all heard about, right?
Well, it's a little bit more complicated than that. The VA and TRICARE not only own hospitals and provide payment for the care, they also employ the doctors and actually provide the care. So it's different from the other systems we've talked about.
Okay. So we're really just left with the people who don't get health insurance through their work at all. They don't qualify for Medicare, they don't qualify for Medicaid, or even one of the military programs. But as you can see, this is still a big chunk, about 6% of Americans. Where do they get their insurance?
Yeah, so these folks buy their insurance on the open market individually. Common scenarios you might see are those who are self-employed, unemployed, or those who work for companies that don't offer insurance.
So if you can just buy insurance on this market, why even have something like the Affordable Care Act? Why doesn't everyone just do this?
It's a good question. So it's actually pretty difficult to buy insurance on your own in the open market. It's confusing, it's difficult to find a good plan, and it's almost always more expensive.